Honorable Premier Dr. D. Orlando Smith, Deputy Premier Dr. the Honorable Kedrick Pickering, Honorable Ronnie Skelton, Minister of Health and Social Development, Honorable Mark Vanterpool, Minister of Communication and Works, members of the House of Assembly, Cabinet Secretary Ms. Sandra Ward, Professor Emeritus Dr. Carl Theodore, Health Economic Unit, University of the West Indies. My protocol is a little out of order, sorry. Members of the House of Assembly, members of the National Health Insurance Steering Committee, Chief Medical Officer, Dr. Irad Potter, Madam PS in the Ministry of Health, Mrs. Petrona Davies, Chief CEO of the Health Services Authority, Mrs. Carty, members of the Social Security Board, senior civil servant, ladies and gentlemen. Good morning. It's my pleasure and privilege to welcome you to this auspicious occasion. Today is another red letter day in the history of the Virgin Islands, a day 25 years plus in the making. These documents I hold before you this morning, and you can see from the paper that they look old. These documents say Health Insurance Act 1990, Health Insurance Regulation 1990. So today has been 25 years plus in the making. Here we are 25 years later, but nothing happens before its time. And the time is ripe for us as a country to ensure that all legal residents of this territory have access to quality health care. Several international agencies, including the International Labour Office, the World Health Organization, the Pan American Health Organization, the World Bank, have all articulated their position that access to health care is a fundamental human right. The right to health has been enshrined in international and regional human rights treaties, as well as many national constitutions around the world. They, like us, believe that good health care is essential to human welfare and to sustain economic and social development, and that people should not be pushed into poverty because of illness that requires them to use up their saving, sell asset, or borrow, destroying their future and after them the future of their children. Statistics from the World Health Organization show that 150 million persons globally suffer financial catastrophe annually, and 100 million are pushed below the poverty line as a result of healthcare expenditure. Healthcare must be provided as a public good to all, regardless of one's ability to pay, or other contingency that today prevents some persons from getting the health care that they need. Health protection is meant to secure population health from birth through to old age, and as some of us would say, from the womb to the tomb. Ladies and gentlemen, this is what your national health insurance is all about. Your national health insurance will provide lifetime coverage, choice of public or private healthcare providers, guarantee payment for approved medical services, improve access to healthcare, early detection and treatment, and will promote healthy lifestyle. This government recognized the need to provide health care for all legal residents of the Virgin Islands, and in 2003, publicly articulated its commitment to create a health care system. Years later, we have arrived today when the promise made is finally realized. And let me say here that the National Health Insurance is just a part of government's comprehensive health reform initiative. Ladies and gentlemen, I beg you not to listen to others, but to take a thorough and comprehensive look at the NHI for yourself. Look at the premiums, look at the benefit package, and you will agree with us that national insurance is not good, but great for all of us in this Virgin Islands. I close with a quotation from Winston Churchill, and he says, "Healthy citizens are the greatest asset a country can have." I thank you. At this time, we'll call our leader of this country, the Honorable Dr. D. Orlando Smith, OBE, to make some remarks.
Today is a day I've been looking forward to for many years. It is a turning point in the history of the Virgin Islands where active steps will be taken to ensure that all residents of the territory have access to health insurance. A day when we as a country can finally say that everybody in the BVI, adults, children, the elderly, will have access to health care that is good and that is affordable. A goal that is recognized by all countries that they should aspire to. I served as a physician here in BVI for many, many years. I recognize that there was quite a great deal to be done to provide the health care that the people of this territory needed. And today I'm more than pleased that we set out to build a first-class institution that we would all be proud of, and that would deliver the care that all our people deserve. And as we all remember, the new hospital was opened in December last year to a great fanfare. I want to thank the Minister, commend the Minister of Health for getting that done. Going hand in hand with the provision of an improved standard of care, for which universally the cost is steadily increasing, and as it must, has, and will in the BVI, going hand in hand with that is health insurance. And while it was okay for those who had private insurance and those covered under the government-provided insurance program to get the care needed both here in the territory and abroad, for the great majority who had no insurance, this was not so. And so we decided as a government back in 2005, 2003, that we would work to make sure that all citizens and residents of this territory had access to a national health insurance program. As a medical doctor and surgeon, I've had first-hand experiences of seeing individuals and their families, especially those who could not afford health insurance, saddened by the financial burden instead of being focused on regaining strength and recuperating. I've seen where high out-of-pocket expenses have created grave concerns for those who could not afford to care for their own health or for that of their families. I've seen many instances where people were denied health care abroad because they did not have health insurance. And more daunting, they were unable to raise funds to finance whatever procedure they had to do. Also, I've seen several cases where people had to use their last dollar to access health services, and as such were unable to pay their rent, their school fees, or even grocery bills at that time. And so the government, in many of those cases, had to step in and provide the requisite funding to ensure that those without insurance still had access to quality health care. As a government, we were heavily subsidizing health care, and particularly hospital care. Something had to be done. But we needed a great deal more than we were able to provide at that time. As a physician and now your premier, I could not sit idly by and not pay attention to these myriad challenges and uncertainty that many of our people faced, especially those without insurance. Many countries around the world have moved in this direction. The United States, United Kingdom, Sweden, France, Canada, and the Virgin Islands will all join a number of Caribbean islands such as Bermuda, Cayman Islands, Turks and Caicos Islands, as well as Antigua and others, who all use some form of national health insurance as a principal source of health financing. My government is committed to developing a healthier Virgin Islands and ensuring that all residents have access to quality healthcare services. This move towards implementing a national health insurance system signals progress in taking care of our people and ensuring that every resident of the Virgin Islands has access to healthcare resources and can receive that quality healthcare. For all of us, national health insurance means that all residents will have access to the kind of healthcare needed, whether in the near future or in years to come. At a time when our health statistics are showing that very large numbers of our population have already contracted lifelong diseases like diabetes, hypertension, cancer, or heart disease, and we are likely to see these numbers going up in the future, and they provide quite a considerable cost to the people who are suffering. And where we likely see these costs going up in the future, it is important that as a country, we put in place a system which will guarantee that we get the care we need when we need it and when the time comes. Our national health insurance system is a critical aspect of the Virgin Islands' national development goals to achieve health security for all and to strengthen the domestic healthcare system to achieve international standards of performance. A critical component of government's health reform strategy is restructuring the health financing system to provide equitable, cover for all the people of the Virgin Islands through the NHI. From an economic perspective, the implications for economy are also very important. We all know that a healthier population is a more productive population, and the most important resource remains our people. Therefore, we must keep them healthy. My government firmly believes that it is our business to take care of the people of this territory, and over the years we have worked diligently to ensure that we have achieved this. And as I've said, 1 year ago we opened a new People's Hospital and demonstrated our commitment to providing the people of Virgin Islands with access to affordable, high-quality health care. And today, with the launch of the NHI, we signal the start of the registration process to that system for ongoing efforts to take care of the people of the territory. For the individual, what the NHI means is that whenever a health situation arises, it will no longer be a financial situation. In a context where we know that getting older usually calls for more health care and more expensive health care, it is good to have a system that takes care of us as we get older. We will not have to worry about that. Because the system will cover all elderly persons and all children, as working adults and parents, we will not have to worry about health care for our parents or for our children. This is the health security which the NHI brings to us as adults. Further, under the National Health Care Program, very importantly, there is no exclusion of pre-existing conditions and referral to overseas care provided for us as with other insurances. As with any new system that is being introduced, we understand that there will be concerns and questions which our National Health Insurance team at the Social Security Board will continue to assist with any clarifications that you may need. This launch is yet another step in strengthening the healthcare system to become even more responsive to the needs of a growing population. We are on a comprehensive health reform agenda, and we are empowering our communities, families, and individuals to take control of their health while ensuring that everyone has access to affordable care. I commend the Minister for Health and Social Development, Honorable Ronnie W. Skelton, and his team at the Ministry of Health and Social Development and the Social Security Board for their steadfastness in bringing this initiative to fruition. I know that this has not been an easy road to this point, and I especially commend the NHI implementation team, led by the Deputy Director of Social Security Board, with responsible for the National Health Insurance, Mr. Roy Barry. I know the implementation team has been hard at work, sensitizing the public and addressing concerns on the NHI. On behalf of the government of the Virgin Islands, I also take this opportunity to express our gratitude to Dr. Carl Theodore, Professor Emeritus, and his team from the Health Economics Unit of the University of the West Indies, whose efforts laid the groundwork for our NHI system. The truth is that the NHI presents a territory with a golden opportunity to make ourselves even better and to achieve a development vision as an ideal place where people will always be happy to claim residence. In closing, let us make no mistake that NHI, as we have designed it, will be a blessing for our Virgin Islands. We are taking another step along the road of progress together and strengthen our future with the National Health Insurance, your security for a lifetime. Thank you.
May I just thank Dr. Carl Theodore for being here with us and for the work he has done to bring us to this point. Dr. Theodore, in 1995, when the Suriname National Health Insurance was in trouble, he was called on, along with a colleague from Canada, to go to Suriname and straighten it up, and he did. Dr. Theodore has looked at national health insurance. I don't think that there's a country you can ask him about the national health insurance and he cannot freely speak about the national health insurance in that country. He's been here with us. He's worked on Turks and Caicos. He's done work in Bermuda. He's done work throughout the Caribbean and throughout the world. And we are pleased that Professor Emeritus Dr. Carl Theodore is here with us to bring us some remarks today. Welcome him, please.
I want to begin by thanking the Social Security Board and Mr. Skelton in particular for inviting me to a day like this. As the Premier said, I always looked forward to this day because having worked on the National Health Insurance program here, it was always my sense that when the time comes, I think those of us who worked with you should be with you to share the moment. So I'm thankful for that. I have a little problem though, because I came to talk about a few things, but having heard Mrs. Skelton and the Premier, I'm wondering what else do I say about National Health Insurance. But since my life, of course, has been talking, I think I must find something. I think what I'll do, first I want to start by put it in an international context here. I think the Premier touched on it. You see, because you ask yourself, where is the world going now? The World Health Assembly is the group of ministers of health and secretaries of health all over the world. And they meet in Geneva every year to decide where the world is going in health, the World Health Assembly. The World Health Organization is the voice of the Assembly, and they do the research that guides the Assembly in making its decisions. About 3 years ago, the Assembly, people from all over the world, they decided that the time had come when every country should adopt something they call universal health coverage. UHC, they call it, universal health coverage. And by that, they meant there were two things they meant. They felt first, as the Premier mentioned, they thought that the time had come when every citizen in our countries, every citizen, should have access to good health care, every single citizen. But they also felt that this should happen in a way which shouldn't present financial difficulties or financial problems for people. So universal health coverage had these two dimensions. Everybody had to be covered, and nobody must suffer financially when they look for help. And as I said, three years ago, they agreed to push all the countries of the road in that direction. Of course, but the BVI, as the Premier said, the BVI started on this direction many years ago. And in that sense, I think we have to give credit to the vision of the BVI leadership for this. And of course, but as I stand here, I think we also have to give credit to the opposition, because the government under Dr. Smith started looking at the program in 2005, 2006, but then the opposition came to power, and to their credit, they continued with the program. It moved a bit slowly, but they actually moved with it. So you have a situation in the BVI where both the government and the opposition are supporting them. And I think the country has to know this, because this is what would help the system to settle down as something that could present the benefits that we think that it will. Now, this push by WHO so that everybody for universal health coverage, what the research in WHO found, you see, was that when they looked at countries all over the world, the countries that were worst off as far as health was concerned were countries where people had to dip in their pockets to pay for health care when they needed to. The second set of countries that were not doing so well were countries where private health insurance was the dominant form of thing. So the World Health Organization in their research felt that if you want to cover everybody, you have to move away from these two things. And you have to move to a system of pooling, where everybody who is capable is going to be required to put something in the pool so that the whole country could benefit. Now, for us in the Caribbean, that is a very interesting kind of result. Because if we have to have a pool that everybody is to benefit from, one of the things we hope is going to happen is that the pool will be large enough to do exactly what we want it to do. It turns out, and I can tell you, every single country we have looked at in this region, when we look at what the country is currently spending on health, and then we ask, okay, suppose we have a national health insurance with a good package, how much that would cost? The cost of that package has never exceeded what the country is currently spending on health. So this notion we hear sometimes that NHI is going to be more expensive, that is nonsense. The NHI is not going to be more expensive than what the country is currently spending. And that is something I want you to remember. The idea of the pool that the WHO has been pushing is an idea that it's what they call, it's a social insurance concept, that where we put together and then we all benefit from it. The concept of social insurance itself is not new, because since 1889 in Germany, Bismarck put it on the table, and from that came our social security systems and so on. But many countries use the concept of social insurance to look at their health systems. In this region, in this hemisphere, Canada, in 1957, Canada started setting up their national health insurances. Now the Canadian system, you know, is the one that everybody in the world looks at as a good example of how to do it. They started in 1957. They completed it, believe it or not, in 1984. They took a long time to really build it up. But that was followed by other countries in Latin America. We now have, of course, Brazil is having a system, Chile is doing a system like that. And as was mentioned, some countries of the region, Suriname, and others have systems like that. And as we all know, President Obama put his presidency on the line by trying to cover everybody in the States, because there is a sense we have now that the world has to go down that road. This is one road that all of us have to walk. Having said that, though, we have to walk this one road, but there's not one model. Different countries are doing it differently. And that is not surprising. Because when you ask yourself what the national health insurance is, what the social insurance approach is, it is an approach that rests on two pillars. There is a health pillar, there's a health need. So the NHI has to reflect what the health needs of the country are. The package that is presented must reflect what the health needs of the country are and what the health needs of the country are projected to be. So that's the first pillar. The second pillar is the financial pillar, the economic capacity of the country to provide the care that we believe is needed. So these two pillars, the system has to rest on these two pillars, and it has to balance on these two pillars. And that is the work that we, the University of Leicester, were invited to help the government with, to help how to set up this thing in a way that it would really balance well. Now, the work of doing that is not easy work. And with all the good, we have heard all the good things that the NHI will do. First of all, it is going to focus, as I said, on what the health needs of the population are, and we're going to try to have a package that addresses those needs. It will make sure that everyone in the country has equal access to that, to this package of care. But it also, all the NHIs are usually set up to concentrate on the prevention side. So the NHI provides support for the ministries of health to strengthen the disease prevention activities that the ministry is involved in. And lastly, and most important, and very importantly, the NHI is also set up in a way so that the cost of healthcare, which everybody is worried about, which keeps going up and up, the NHI is set up in such a way that those costs could be monitored and controlled. Now, when you set up a system like that, what you're saying is that you are taking a step to improve the quality of the health system you have in the country, and you're taking a step to improve the quality of life in this country. Now, these are objectives that are major objectives. There is a challenge, though, that I think I want to leave you with. There's a challenge that we have with it. The big challenge with the NHI always is management. Let me tell you why. You see, the NHI is really, it's, as I said, it is a pool. There is an inflow to the pool, and there's an outflow from the pool. So somebody has to make sure, you know, that the inflows and outflows are operating in a way that the pool does not run dry. Somebody has to make sure that that's happening. And that is not an easy thing to do. But here is where the BVI can be comfortable, because the agency in charge of the NHI, your Social Security Board, has been managing such a pool for the last 35 years. It's the same kind of pool. Right? So I think in this country, people don't have to worry about the management. The management is crucial, but the management of the BVI NHI is in good hands. There's no doubt about that. So I just want to, and well, I want to say before I end that, you know, we are labeled as the consultants on this project. And we do work all over the region. But the University of the West Indies, and in particular the Center for Health Economics, is not a consulting firm. We don't come and do work for you, then hop our planes and go home, and that's the end of it. It doesn't work like that with us. The university always sees itself as working with the countries of the region to do the things that the countries would like to do for themselves. So we come and work with people, and we also train people to ensure that what you want to do can be done for yourself. And the assurance that we give every country, and the assurance that's given to the BVI, and has been given to the BVI, is that although the quote-unquote consultancy has ended, the HU is always there on call. We are here to respond to any needs they have to help this system to settle down well. We are here to do it, and it's not being done at a professional cost. There are no charges that the university makes at that stage. All we need is to cover our expenses, our travel expenses, and so on, and we will come and help. We are in your corner with the NHI, and our wish and our willingness to help you is to make sure that what we do is something that would lift the standard of every single person in this country. And as the Premier said, it would make this place a place where every person will be able to say, I am happy to be a citizen or a resident of this place. Thank you very much.
Really thank you all for coming. If passion and interest could have started NHI 3-4 years ago, it would have been started by the passion of Dr. Kedrick Pickering. He feels that he knows that national health insurance is a need. And I think that left to him, it would have started a long time ago, but we wanted to make sure we got it right so that when Dr. Theodore gets up and said that the management is going to do a good job, we're confident that we will do a good job and everything is in place. So one of the most passionate supporters of National Health Insurance is Dr. Kedrick Pickering. I'll ask you to welcome him, please.
A very pleasant good morning to all of you, because this is a red letter day in the history of the British Virgin Islands. The 14th century political activist and philosopher Niccolo Machiavelli said, and I quote, that there is nothing more difficult to take in hand, more perilous to conduct, or more uncertain in its success than to take the lead in the introduction of a new order of things, unquote. When we were in the government between 2003 and 2007, and we had our first introduction to the idea of building a new hospital and all the other issues that would go along with it, had the opportunity to meet Professor Theodore for the very first time, and there are two things that he said at that point in time that I remember and I continue to quote. Professor Theodore, y'all could excuse me, I need to put my shades on. I'm sorry, the glare is killing me. Thank you. He said that this is so bright, I had to dim it down a little bit. Professor Theodore said at that time, he said that the introduction of the National Health Insurance Scheme to the BVI will change the economy of the BVI forever in a way that will cause the BVI and its economy to almost leapfrog the rest of the Caribbean, and we could become a model for others to follow. He also said at that time that so important the NHI was to the function of the new hospital that we were about to build, that it was important that it be established and up and running at least 18 months before the hospital was functional. That was necessary to ensure that the very point that he was just making about inflows and outflows will be taken care of. We're behind the 8 ball. We are behind the curve. But nonetheless, we are here today. And so, Professor Theodore, not only am I one of the biggest supporters of the NHI, but because I've practiced as a physician in this country since 1986, and I've had the opportunity to watch the transition from where we have been to where we are, I'm deeply honored to be a part of this ceremony here today. I remember in 1998, Dr. Smith and I sitting in the operating room on a Wednesday, one of those long days that we had of many. He was operating, I was assisting him. And he was at the point of his career where he was thinking about retiring from the public service, and he said to me, you know, Kedrick, what are we going to do to improve the overall health system? What are we going to do to make our country better? And shortly thereafter, the concept of the National Democratic Party evolved, and the elections of 1999 tells its own story, and the history book will be written, and in time, Dr. Smith will be immortalized in the history and annals of this country for not only the work that he has done in bringing healthcare to where it's at, but in what he has done in the terms of the overall leadership of this country in spearheading the new hospital under the leadership of Honorable Ronnie W. Skelton, and now to where we are today. I think Dr. Smith deserves a round of applause for that. Part of the government's overall vision for this country is that we want to build a great little nation. Some of the richest countries in the world, and certainly some are based on the indices, some of the happiest countries in the world. In fact, Denmark in the Scandinavian countries has been voted as one of the happiest places on earth. When you study the economies of the Scandinavian countries, not only are they some of the richest countries, but they also have some of the best social programs anywhere in the world. It is said, for instance, in Denmark, that people pay upward of 50-something% in various taxes and social schemes during their working time, but it guarantees every single citizen in a place like Denmark that you will live happily ever after, because during your years when you're not able to work, the system takes care of you. Your investments that you have made are then realized. We have a dream in this country that we will become a model in the Caribbean of being one of the richest, wealthiest countries in the world, and in the Caribbean and probably in the world, because we're not thinking purely in terms of monetary issues. We are thinking about the health of our people and the health of our nation. Recorded in the book of Timothy, it is said that if you wanted to read it, I paraphrase it in 1 Timothy chapter 6 and verse 9, it says that men, for the purposes of their own existence, will use their health when they're young to gain their wealth. And as they become older, they then use that wealth that they've accumulated to try and maintain your health. NHI speaks volumes in the context of what Timothy was talking about years ago, because NHI takes care of you from the beginning to the end. And for those of you who are wondering even further, as you get older, when you no longer work in your retirement years, and even if you have the best private health insurance in the world, this is what happens. Your cost of insurance goes up, your benefits go down. That won't happen with the National Health Insurance Scheme. And that won't happen in the British Virgin Islands. Some of the people who are anti-NHI and have been criticizing it talk about what their private health insurance can give them and where it can take them and what they can get. Well, let me say this to them and to all of you who would listen. God forbid if you have an accident. God forbid if something happens to you and you need emergency care. That is what we saw several years ago, that the services that were offered at the People's Hospital were insufficient to take care of the emergent and urgent needs of our citizens. Reflect with me for a minute. If you remember, right, Sister Pemberton, sitting in the audience, you remember the hospital as it was, the entrance from the seaside, the little room that was then the emergency room at the hospital. We had 4 beds in there, and you used to fall over each other trying to take care of people. If you had an accident, it was a nightmare trying to take care of more than 4 people at a time. fast forward your minds and compare that now. Those of you who have had the opportunity to walk into the New People's Hospital and see what the emergency room looks like. But somebody's got to pay for it. You can't have a nice vacation and at the end your credit card is just going to stay there and somebody's going to pick up the tab. Somebody has got to pay the bill. And somebody has been paying the bill all the time. What Professor Theodore just explained is that we are finding a more equitable system to be able to take care of our bills. The bills are not going to disappear. Minister Skelton has to pull out his hairs all the time when people have to be transferred overseas and then the bill come back to you. I didn't mean that literally, did I? When the bill comes back and says that the individual has accumulated a bill of $150,000 in some hospital in Florida or Puerto Rico, the money has got to come from somewhere. But the system that we are creating is going to ensure that there will be money to take care of those needs. In medical terms, any medical student, any nurse, anybody involved in the management of patients have to learn what is called the ABC of management. If you have an emergency, there's something called ABC. You've got to attend to the patient's airway, you've got to make sure the person is breathing, and you've got to ensure that the blood is flowing. Airway, breathing, circulation. You have to say it like it's a recitation. If you don't know that, you can't save anybody's life. This government has done what is necessary to ensure that the ABC of the management section of your healthcare is taken care of. So we've expanded the A to mean we've now provided you access. You now have access. You have access to all the doctors locally and the hospital will be at your disposal. And that includes every single person who is living in the BVI. We have persons among us who live from paycheck to paycheck. They can't afford private insurance. But if they get sick and they come to the hospital, they've got to be taken care of. Who pays the bill? The government has to pay the bill. The system now ensures that that person themselves can help take care of their needs and all of us bear the burden. So the A is access. The B, we've expanded the B to say that we have breathed new life into our healthcare system. We built a new hospital. Challenge any of you to go down there and look at it and say that we haven't done a great job and that the country can now be proud. Honorable Ronnie Skelton deserves a clap for that. And the C, as I mentioned to you, in terms of circulation, meaning the blood must flow, is that the NHI now flows through the veins of every citizen, local, non-local, belonger, non-belonger, resident or non-resident. The National Health Insurance ensures that health will flow through the veins of every single person in the country because it provides a system that ensures that all of us, indigent, non-indigent, whether you have it or you don't have it, will be able to access health care. And so the National Health Insurance, you turn me on, I could talk about it all day. Talk about passion. I understand the importance of it, and I understand how important it is for the overall health of this country and this great little nation that we are building. One last word, and then I'm done. I understand, I don't read blogs, that there's a debate on the blog that the National Health Insurance Scheme is going to be the death of the NDP. You know what it is going to do? It may be the death of the NDP, quote unquote. But my good book tells me that if anything is going to have new life, it must first die unto itself. The old ways of doing business are now finished. The National Health Insurance Scheme is a new way. When you sow a seed, you don't get up tomorrow and eat mango. I tell my patients when they labor, when they're laboring, I say, they don't call it labor for nothing. Labor means you got to do some work. If you want to hold that little baby in your arm and hug them and kiss them and smile and all the other things that go along with it, you got to do a little work. And so the harder you push, the longer you push, the shorter the duration of the labor will be. The work we've done and the registration process will have growing pains. But ultimately, that beautiful day will come when all of us will enjoy it. God bless you, and God continue to bless the Virgin Islands.
Several years ago, Honorable Mark Vanterpool served on the Social Security Board. And I say to my staff, many of them are there in the back-end staff meeting, that Social Security and a lot of the benefit that we enjoy as employees are due to the effort of Honorable Mark Vanterpool. And I don't know if I said it publicly, but we want to thank you. I think I can thank you on behalf of all my staff for your contribution for those here and for making our life a lot better. Welcome, welcome Honorable Mark Vanterpool to the podium, please.
I am ecstatic to be standing here on a special day like today. Like Dr. Pickens said, it's a red letter day. I don't know sometimes if you, and in fact, many of us may not understand, and I myself don't totally fathom the importance of today. But I can't look through a crystal ball and see it, but I want you to understand that this day, 20 years from now, 25 years from now, even 5 or 10 years from now, almost every person in the Virgin Islands will say, thank God for the day that we instituted national health insurance. I'm very confident about it. I have sat on the board of the Social Security for many years. I saw it grow. I saw it criticized. I saw it launched. Ms. Skelton, our board meetings used to be up in that building where, it's not where Right Way is now in town, but the building next to it, upstairs where there's some bars and so on now. We sat up there in many meetings planning Social Security and how it will grow. And is there anyone in the audience today, please put your hand up if you're not happy about Social Security for the Virgin Islands. Please put your hand up. Well, you wouldn't understand, but on the day it was launched, just like today, there were major critics of the Social Security scheme in the Virgin Islands. But look at what it is today. $500 million later, security for many who have worked here, and not just who live here still, but who are all over the world, who receive a Social Security Board check from the Virgin Islands every month. Give a round of applause to the Social Security Board. Thank God for it. And it takes the will, and it takes the heart, and it takes the desire of leaders. What did the song say? Courage of great leaders. To put systems and security in place for its residents, because even though there is criticism today, the vision that persons like Honorable Abdi Stout and others have had, the vision that we have today for national health insurance is a strong, solid vision for the improvement and security of health for the people of the Virgin Islands. And I want to say you've got to give a big round of applause to those leaders who have stood up. I sit in the room, and I'm passionate about it. And I made a mistake and told Honorable Skelton, anytime you want somebody to get up and defend national health insurance scheme, you call on me. And by God, I walk up here today, I was speaking. So he called on me, and I couldn't back down. But I had to tell you that this is not as simple as it is. I was wishing that I could see crowds and crowds here today. But that's not how these kinds of schemes and these plans work. People are waiting in the corners to see if it will work. And that's okay, because that's human nature. But I want you to understand that your leaders, not just on this side of the aisle, but your leaders believe that this is something good for the territory. Please understand that at the beginning of Social Security Board development, everything was not perfect. It took years of changes to the legislation, years of changes to policy, years of changes to procedure. But over time, it has built to be one of the strongest in the world. It's going to be the same thing for the national health insurance as we develop it. It's going to take time. We're going to have to make adjustments. But I will tell you that at the end of the day, we want you, the people of the Virgin Islands, not just who are belongers, but those of you who reside and work here, to be confident and understand that this is in the best interest of you, the people who live in the Virgin Islands. Ladies and gentlemen, 3 3/4% of your wages you may be concerned about. But I have more concerns than that, because I have had very personal experiences on a regular basis, up to this year many times, when persons not only in my establishment, when persons not only in my constituency, when persons who have come to my office, is Miss Marion Turnbull here, or Miss Penn from the social office of the hospital. I hope they're not here, because every time I see them I hide. Or when I see a call from one of them, I think twice. But these folks are trying to make sure to help people in cases of emergency to get to places where they can get attention urgently. And I have had on many occasions, they will testify to you, not just now, not just since I've been in politics, but I have had on many occasions to dip my hand in my pocket when sometimes I couldn't even afford it. And I'll go around and call up on many friends, urgently, within hours sometimes, to raise $5,000, $10,000 cash. When you look on a bed, or when you look in the eyes of that wife, or that husband, or that child of a mother, and you look in the eyes, and you realize that they are urgently in need of getting their mother or their husband or their wife or their whomever relative or friend to be flown out of here urgently within hours, and they don't have the cash. And the ambulance, I have been on the phone and heard them say, without that cash that you will transfer to wherever, and we have that receipt, we are not leaving from wherever they have to leave to come to fly out that loved one. And the loved one look you in the eye, hoping that you can go out there and find some friends to help them raise that cash in a moment. And when you fail, you feel bad about it. But when you're able to raise the money and you got them flown out and they come back and they look strong and healthy, you feel good about it. Ladies and gentlemen, I feel good that this year, that $6,000 that I had to give up some Saturday ago, and that $10,000 I had to find, not $11,000 I had to find some time back, and all those kinds of cash. I am happy that today that I won't have to do that anymore. That's not a joke. That's the truth about it. Under the National Health Insurance Scheme for every single person living in the Virgin Islands. And I say, and I emphasize every single person, because it's important for me to emphasize that. Because there are those of us who may have insurance, and we don't think of our neighbors next to us. We don't think of a mother or father who may not have it. And when the time comes that they need it, our health insurance can't help them. So this National Health Insurance Scheme is about helping others. And that is what Jesus said. When you have helped one of these, that's how you're going to enter the kingdom. So I want you to understand. I want you to understand that today is not about me, about you, or me or you who have a good job in a good trust company, or me or you who have a good job under the government that you're protected. Today is about helping all of the people of the Virgin Islands. The little children, the older folks, those who are in the middle who can't afford to have a health insurance. Today is about them. And I want us to put aside our selfish thoughts, put aside our haughtiness, put aside our security that we have in our own insurance scheme that you may have, and think of all of the people of the Virgin Islands, and understand that when you deduct 3 3/4% from your wages, you are guaranteeing yourself a longer, more secure health insurance than you have. But not only that, you are ensuring that there's health insurance for all those around you. But the truth be told, you know that the health insurance in the world today, they're all dodging and ducking. I heard them talking in the news. They're dodging and ducking, paying out for health insurance bills as much as they can. And you know that when you go, and this year you have some situation that you can't handle, or you know that you have some disease that you have just discovered, or you know that you have just seen a lump in your breast, or you have just been told by the doctor that prostate is on the way, and you know that when they discover that next year your health insurance is either denied or the premium is seriously increased. You know how to operate. Ladies and gentlemen, understand that under the National Health Insurance Scheme of the Virgin Islands, you will never be denied coverage. No matter how old you get, no matter how sick you get, no matter where you are, your coverage is always there under this. You bring another insurance company to me and show me that one that will give you that kind of coverage, and I will say, go ahead. This and these are the facts of the National Health Insurance of the Virgin Islands. I am pleased that as a businessman in my establishment today, and I may have to write the biggest check, one of the biggest checks on a monthly basis of employers, but I'm going to write that check with pleasure because I'm going to feel comfortable that my employees are covered and they're not covered at a cost that I may not be able to afford. But I know when they get sick and they come to me and they say, sir, I don't have the money. I want you to lend me $1,000 or $2,000 to go for this test or that test. And I can't say no. But under the scheme, I don't have to lend them any money. They have the money covered under national health insurance. These are the facts. I am not talking out of some playbook. These are the facts of the national health insurance of the Virgin Islands. So I want you to understand that the naysayers, tell them be nay. But I want you to understand that we are going to be yay in going forward with the health security for the people of the Virgin Islands. So when you write that check, or when you deduct that money from your employee, you let them be comforted that under this system that we are producing, they will be covered and they will be secure, and their health, along with the best hospital in the Caribbean, will be able to provide them with a good health care. So I want you to understand that when I told the minister I will be willing to stand up any day, you talk about passion, you think like a pig and passionate? Yeah, I know them doctors. Those doctors, the two of them behind me here, come in the room and they've been in the operating room. They've been in situations where they see and they've had to give free health care because people couldn't afford it. They have seen in the same eyes that I talk about, that I have seen, people's despair and despondency. So that's why they're passionate about it, because they want to make sure that health care is assured to their people. I've seen their passion, but I have passion too. Because my pocket have told. So I have some passion. So this morning, I want you to understand. This doctor always checking on my heart. And I did promise him I'll cool down this year. But for today, I'm excused. So ladies and gentlemen, please, thank you for coming out. I want to let you know that as a leader in this territory, as a citizen, as one of the first who's going to sign up for this health care, I want you to know, as one man used to say, Honorable Christian, good thing. Good thing today. So I want you to give the National Health Insurance Scheme a big round of applause and give it your full support. Thank you very much. Thank you, Honorable Skelton, for moving along without fear. Thank you.
Dr. Pickwick, Honorable Mark Wentapoo just move you down on the passionate scale. Dr. Honorable Vanderpool, I have to correct one thing you say. Don't think you'll mind me doing this publicly. Social Security now has $543 million, not 500. And it is the public's money that we have committed to manage. But there's not a day, the manager of the department is back there and she can verify it, not a day that somebody does not walk in here expecting us to be able to pay the hospital bill. We tell them we can't do that. Starting January 1, when they come in, we'll be happy to do that. Honorable Vanterpool spoke about the naysayers, and there are many of those. But we have some persons who recognize the value of the National Health Insurance because they've taken the time out to read it. Before I said that, Brother Barry, when you're going on your public campaign, don't forget to call Honorable Mark Vanterpool, please. He said he'd be right there. But there are some persons, let me get back to the point I was making, who've taken the time out to read, to question, and to understand what National Health Insurance is all about. One such person is Mrs. Marlene Penn-Trotman. So we've asked her to come and say a few words and to encourage those persons who are not willing to take the time out to see what National Health Insurance is all about. Mrs. Penn-Trotman?
I am sure that some of you are familiar with this voice, which for 11 years on Radio ZBVI preached the gospel of healthy eating and living a healthy lifestyle. I am equally sure that everyone agrees with me that good health and good health care service is of utmost importance. As a British Virgin Islander and a senior citizen, one who has lived elsewhere for many years, I acquired health insurance, which unfortunately is only applicable in the US. And let me tell you, when I had my 70th birthday, and I proudly walked up to the licensing, vehicle licensing, and I was told that no longer can I have a 3-year license, and furthermore, I have to go to a doctor and be certified that I can see well and, that my health was good. And I fussed and complained. I went to the first doctor, the first year, the 70th year, paid one fee. Next year, the fee had gone up for a doctor's examination. And so on, it continued. Now, those of you, I don't see too many people in this audience who are 70 or over, but those of you who may be listening by radio know that at that age, we are on a fixed income. And that means that you have to put your hand in your pocket to pay these exorbitant fees. I am so happy. I'm so happy that this government has decided to take care of us, especially those of us who are in our, what do we call it? Twilight? No. We're not ready. We're not ready yet. Senior years. I really therefore welcome this National Health Insurance program, and it does not, one of the benefits is that it does not discriminate because of age, pre-existing conditions, and employment status. This will afford me and the rest of you the ability to access the quality health care services that is so important and very necessary. And you know what I'm talking about. I am sure that there are other senior citizens who, like myself, will welcome this plan. I therefore commend this government for caring enough for its people, and I've heard a lot of passion here. I know there's a lot of love. I know they love me, even though I give them beans sometimes. Poor Dr. Smith. But we're related, you see, and we're still very good friends. But they do care for us, and they're showing how much they love us and care for us. whether you were born here or have chosen to live and work among us in these beautiful Virgin Islands, we thank you for implementing this National Health Insurance Program, which will, as our Minister for Health and Social Development puts it, strengthen our health sector, improve our standard of living, and of course, make the BVI a healthier place. Isn't that what we all want?
Yes.
We don't want just to live to be 70, 80, 90. We want those years to be active and productive. We have a lot in our brains that we need to pass on, but to be able to do so, we have to be healthy. I don't know if I should tell you how many over 70, but still very active, and really it is extremely important. And I can't say it, I don't know how else to say it, to impress upon you the importance of this national health insurance, which will be coming on board shortly. Oh, and I'd like to tell you, I've already registered. Okay. Another good thing about it, it's not only for BVI landers, it's for all persons residing here so that they're able to access quality health services, which everyone needs and deserves. Speaking for myself, and hopefully for many, many other persons, I am excited about this national health insurance for which I have already registered. The positive impact I'm sure it will have on the health of myself and the people of these beautiful Virgin Islands. I therefore urge all employers and employees living among us to register in our National Health Insurance Program. The benefits of this partnership between government, employers, and employees will be great. Now, let me also encourage you, those of you who are computer literate, I just barely get by, but it's all there. I went on, I found the website, I read it, and so you can access all the questions that you have. I know that they're going to be giving you some brochures later on, and for those of you who are not computer literate, but you can have all your questions answered. So you may log in to www.nhi.vg, or you may call the offices of Social Security 494-3418, extension 406. Thank you very much, and I must repeat myself because I know it is of the utmost importance. I know what my health bills are like, and I know that it's comforting to know that I will be able to deal with that as soon as this program comes on stream. Thank you very much.
My minister, who when I call him about anything, he said, Antoinette, you know we want this national health insurance. You do what you have to do to get it up and running. One of the things that my minister assured me that you can call me anytime. And I call him, sometimes he doesn't answer, but he calls right back. So I am pleased, extremely pleased, that we have reached this day, a day that Honorable Ronnie Skelton has worked long and hard for, when we can start our NHI. And I know he is pleased and proud. He said he doesn't have any hair, but his hair, what we can see, they're probably standing up. So we're going to ask Honorable Ronnie Skelton, my minister, to come to the podium.
Mr. Roy Barry, I think I'm going to have to mention him a couple of times because he needs all the support we can give him. He was on the front line. And if I can turn to Mr. Kevin Smith, those Marines who on the front line normally get the most bullets. So while it may look like Mr. Roy Barry was leading the charge himself, I think he deserves our appreciation that he went out there to fight this fight, he and his team. Fellow residents of the Virgin Islands, members of the media, good morning to each and every one of you. I must start by when I first became a government minister in 2003. One of the policies championed by the then Chief Minister D. Orlando Smith, now Premier D. Orlando Smith, was his long-held aspiration of universal health coverage for the people of the Virgin Islands. He envisioned a community where everyone will have access to quality health care and financial protection. And not just the rich or lucky or the well-connected, but also the average citizen and residents in the Virgin Islands. I must admit that in the beginning, I was not completely sold on the idea that NHI was the best way to achieve the goal, to achieve this goal. We needed to examine the data and all the available evidence, which we painstakingly did. When the government changed in 2007, the new administration did the same thing. They commissioned new studies and again carefully examined all the options. We all arrived at the same conclusion after 12 years of study, that universal health coverage through pool contributions was a logical solution from both an economic and human rights perspective. My conviction strengthened after serving as Minister for Health and Social Development for 2 terms. I experienced firsthand the suffering of so many families year after year that could not raise the money to pay for their much needed treatment and care. Several persons were struck with illnesses or injuries that caused them to use their entire life savings or sell their land and or other hard-earned assets to pay for the health care they needed to save their lives, the lives of their children or their family. In some instances, private insurance denied the claims, or the insurance, as Marlene just mentioned, did not work or it ran out. And the government will assist by providing financial guarantees to healthcare institutions here at home and overseas in order to protect our people from being denied care or from impending financial disaster. The BVI Health Services Authority has recorded over $24 million in outstanding obligations. Millions of dollars were leaving our economy every year as demand increased for services that were not available in the Virgin Islands, posing a threat to our economy as a whole. Families complain of the considerable inconvenience and expense of having to travel overseas for hospital services that in many instances could be provided right here at home with strategic partnerships and investment in our domestic health system. We also recognize that the diseases that were costing the most money to treat and striking down our loved ones in the prime of their lives were lifestyle-related diseases that were largely preventable. Healthcare costs continue to escalate rapidly, and so did the rate of illnesses and injuries affecting our people, and diminishing the productivity of our labor force. Something had to be done. We recognize that this health crisis is not unique to the Virgin Islands. Therefore, we investigated healthcare provisions in other countries to see how they mitigated similar constraints and circumstances. We found that countries of the world with the healthiest population and best health outcomes were the ones that provided universal access to health care for their citizens and residents. Universal health coverage involves equal access to needed health care for all people, wherever they live and work, in the formal or informal economy, the poor or the wealthy, the male or female, the young or old. Investment in health not only promotes social stability, but also have multiplier effect for the growth of the wider economy. Simply put, investment in healthcare is good for our country. And so we set out to build a sustainable health system that will, one, promote wellness and prevention, to revitalize primary health care, to promote early detection and intervention, and expand physical access to services. Bring more specialists, doctors, equipment, and services to this territory, and provide health insurance coverage to the entire population, regardless of age, gender, medical condition, employment, or other status. As our national health strategy began to take shape, we established a Health and Wellness Council to guide the implementation of our national strategy for the prevention and control of non-communicable diseases. We formed strategic partnerships to recruit, train, and retain quality healthcare professionals and improve the quality of clinical care to internationally recognized standards. We are building infrastructure that includes a new state-of-the-art People's Hospital, new North Iris O'Neill Medical Center on Virgin Gorda that is being built as we speak, an emergency call handling and dispatch center that is being built as we speak, and the development of polyclinics in strategic location, one in Eastern Longlook and the other in Capoons Bay. And we are now implementing a long-awaited health insurance system that we are here to launch today. Ladies and gentlemen, sometimes the right path is not the easiest path, the easiest one. And permit me to say that health reform and social transformation are not for the faint of heart. The Social Security Board recently celebrated its 35th anniversary. Those of us who have been around long enough, like Marlene and I, will remember the level of fear, propaganda, and protests that seized the territory when it was first introduced. The Chief Minister at the time, the late H. Lavely Stout, was even abandoned by his own cabinet colleagues. And he famously relied on opposition to make the Social Security system a reality that we are so proud of today. Here today, 35 years after, the situation is different. My colleagues and I unanimously agreed that the NHI is the right system for the Virgin Islands. Am I wrong? No. Myron, I'm not hearing you. Oh, you're not over here. Sorry, you're over there. National health insurance is to health care what Social Security is to our pension and employment income protection. We cannot build a great little nation without the NHI. We anticipate that there will be many questions and concerns about the national health insurance systems, and we will continue to diligently address those in our plan. As I explained before, we sought expert advice, and you hear Professor Carl Theodore told you the same thing. We sought expert advice in designing the NHI model that will best suit the Virgin Islands population as a whole. The analysis and assessment, we have done the feasibility and actual studies. We have conducted thorough research and assessments, and we have developed a sustainable plan that fits our needs, and we've been doing it for the last 12 years. The analysis and assessment will continue as we gain actual utilization data during the implementation phase, and the system will be adjusted to iron out any kinks over time. Some of us fear that person earning minimum wage cannot afford to pay $24 a month for comprehensive health insurance. We say to them, I say to them, can they afford not to? This is a peace of mind investment. It must be seen as money in the bank to take care of your health emergencies and peace of mind for our relatives and our wider community. The private insurance industry claims that NHI will cost more. I need to deviate from my ratings. They said NHI will cost more. Over the last 12 years, I have had discussions with providers of health insurance. Without calling names, they all, not all, but most came to the conclusion that NHI is the right system for the Virgin Islands because they all was recording claims in excess of 100% of premiums. And they feel that it was unsustainable. So here it is, we are now building the system. And at the 11th hour, they come up on the radio, they have an old association, and when we needed them, they were nowhere to be found. But persons with private health insurance can do the math and see that entire families can be covered under the NHI at a fraction of the cost of private insurance. Others say that NHI is a good thing, but it should only apply to persons who don't already have private insurance. When we spoke to countries of similar size that have taken that approach, they found it unsustainable. And they are in fact looking at ways to transition to this model. I wanted to put in a phrase out to those of us who much is given, much is expected. So those of us who can afford to pay more, the BVI has created, the BVI has an economy that allows all of us, the majority of us, if we want to work, to have a high standard of living. And those of us who are doing well cannot look over our fences and see our neighbors who are not doing well and ignore their plight. This is what the NHI is trying to address. We have even been accused of introducing NHI as a way to pay for the new People's Hospital and reduce government spending on healthcare. But ladies and gentlemen, the truth is that with the same level of government expenditure, the government will now be able to provide comprehensive coverage for the entire population and not just those who cannot afford to pay. Every resident will have access to our modern facilities and services, whether in the public or private sector, without having to choose between buying groceries and paying for their visits to the doctor. With the NHI, they will be able to do both and not have to gamble with their health. Fellow Virgin Islanders and residents, let me say how grateful I am for your patience and support over the years as we work to make the National Health Insurance System a reality. I am especially grateful to the NHI Steering Committee, led by Mr. Barry, and the many professionals who serve in various capacities to guide this project to successful completion. Particular mention must be made of the University of the West Indies Health Economic Unit under the leadership of Professor Caltedo for the expert advice and assistance. Thanks also to the Social Security Board and its NHI division for leading the charge towards full implementation. Based on the stellar performance of the Social Security Board over the past 35 years, we are confident, I am confident that the NHI administration is in very capable hands. As you have heard, my colleagues and I have gathered here this morning to commemorate this historic occasion by completing registration and receiving our NHI cards. Over the next several months, the NHI team will be working diligently to do the same for every man, woman, and child living in the Virgin Islands. This is not an easy undertaking, but I encourage you to pay attention to the notices of the various phases of registration process, at the various phases of registration process are announced. My team from the Ministry of Health and Social Development and the Social Security Board will remain on hand to address any particular questions you may have about the registration process and to further clarify the overall design and benefits of the National Health Insurance System. I take this opportunity to thank our media partners for attending here today and for diligently seeking factual information in order to get the NHI message out to the public, and affording us the opportunity to hear and consider a wide range of perspective. So, Suzanne, when you're doing the announcement, you can do the negative and the positive and let people make their mind up. Despite our diversity, a common thread that binds us together in the Virgin Islands is the ambition and drive to achieve and become the best that we can be. Our health system will achieve its fullest potential. The people of the Virgin Islands will achieve its highest attainable standard of health care. The territory of the Virgin Islands will become a beacon in the Caribbean and take its place on the world stage in health. This is our vision. This is our goal. This is our commitment to the people of the Virgin Islands. May Jehovah continue to bless us all with wisdom, courage, and good health. Thank you for listening.
One correction for our website, it's www.vinhi.vg. Today was a great day. Today was a great day. It's a great day for us here. It's a great day for all the people of the Virgin Islands. And not to prolong this any longer, but Mrs. Penn-Trotman spoke about when she paid and when she paid. One time I got sick, because I can give my testimony, and Dr. Pickering had to send me out. And then he had a fight with the ambulance company, the insurance company, because they were not willing to pay the cost of the ambulance when my policy said that I would have those kind of coverage. So, promise you, those of you here and those who you in the public, that will not happen under NHI. That will not happen. I want to thank all of you for coming out. I want to say a special thanks to the ministers of government for participating in today's program, and for Cabinet as a whole and House of Assembly for its support and for providing the necessary funds for us to be here where we are today. The government was and is committed to NHI, and they supplied all we needed in terms of support and fund. I want to thank Dr. Theodore, and not only Dr. Theodore, but Mrs. Theodore, who's in Tampa by herself, awaiting his arrival this evening, for taking the time out of his schedule to be here with us. Thank you, Mrs. Penn-Trotman, and I hope that the message that you sent have gotten across. I do not want to get in trouble, but I have to name some persons who I must thank. I want to thank the steering committee, which was headed up by our PS. I want to thank her for her support. I want to thank you for your commitment, Madam PS. She's smiling because sometimes we were, but it was all for the common good. So we're here today. The other members of the committee was Mrs. Darlene Cathy Baptiste Cathy, Dr. Potter. The first time I met Dr. Potter was sometime shortly after joining Social Security, and we had gone to St. Lucia on a health financing conference, and he did a presentation, and I was in awe that it looked like to me he was studying it all through his life, and he was a valuable contributor to that committee. Mr. Barry is also a member of that committee, and myself. Did I miss anybody? The PR team is headed up by Mr. Cromwell Smith and Mrs. Boynes and Ms. Several. I want to thank them for their contribution. I want to thank the NHI implementation team, again headed up by Mr. Barry. The other members are Ms. Kishma Banville and Mrs. Nama Benjamin. I want to thank them for the work that they've done and they will continue to do. And all the other members of the NHI team. I want to thank the Social Security Board, the members for their continued support. I want to thank the press for being here today, and especially ZBVI for the live broadcast. Finally, I want to thank, you see this little lady over there? Stand up, Vince. She's the smallest member of staff. She's the most fiery and the smart. This morning, somehow in my mind, she told me she was going to be here at 6:30. So I was here waiting to get all of this ready for. She was here shortly thereafter. She said 7. Vince is one of all my staff. I don't want to get in trouble, hard working. But when it comes to things like this, you can count on Vince. Vince, I publicly say thank you to you. I don't know where Jose went, but Jose was also here this morning at 6:30. So Jose, I thank you very much. And finally, I want to thank Mr. Colin Scatliff for the number of hours he put in to make sure that the IT system is up and working. And then we have with us some folks from our IT specialists who are here because we know what happened when Obamacare started and there was problem with IT system. So we have them here to make sure that doesn't happen. Could you please stand, the members of the IT consulting team? Thank you. Ladies and gentlemen, I thank you for being here with us. I thank the listening audience, and I pray that God will continue to bless you. Thank you.
Thank you.